case with the Bangladeshi doctor who was a doctor in Bangladesh, retired in his 60s and moved to the States because their son sponsored this elderly father and his elderly mother to come and live with him in Queens. The son does not make a lot of money, so the father and the mother have to help somehow. Now, they don't qualify for Medicare. They're legal permanent residents. They have not been here for 5 years. The father has diabetes, he has hypertension, and he's 66. He could qualify for Medicare, but he doesn't because of the immigration part. Second, you now might think he might qualify for Medicaid, but he makes just a little too much more money than Medicaid would allow him to make, and he cannot not work. He's working as a security guard. So because he was a doctor, so somehow he has this sense of self-medicating, and he figures out some ways of doing it, and he hasn't been able to go to a doctor. Last time I saw him, he had to be rushed to an emergency hospital at Elmhurst. And that's because of the agency options where you could pay a sliding scale fee eventually, and he didn't want to go to the emergency room because he did not know the regulations, he did not know the laws. I had to literally guarantee him that if he went to this hospital, he will be seen. If he got a bill, I will help him pay for it. And that's the only way I convinced him to actually go to a hospital. If this man, if something had happened to him, the way he's living, whose fault is that? He's a legal permanent resident. He's paying taxes, and he's not getting anything back. And for those Medicare, you need 40 work quarters to get full Medicare. This man is never going to have 40 work quarters. I can already see it. He's only been here for 3 years. He's already in his late 60s. He's already very ill. So is he never ever going to have these rights that we would take for granted? So that's some of the questions that we need to actually consider when we talk about health reform. And I'm all for it. Thank you very much.